Aphasia is a communication disorder. It affects a person's ability to speak, understand, read, and write. Strokes are a common cause of aphasia. Brain injuries, tumors, and infections can also lead to aphasia. Aphasia impacts each person differently. Imagine a musician unable to play their instrument. This is similar to how someone with aphasia might feel. The ability to communicate is disrupted. This can be frustrating and isolating. Aphasia results from damage to language centers in the brain. These centers are primarily located in the left hemisphere. Different types of aphasia arise depending on the specific area affected. Let's explore some common types. Broca's aphasia affects speech production. Individuals have difficulty forming words and sentences. They understand language better than they can speak it. The Broca's area, located in the frontal lobe, is responsible for speech production. For instance, someone with Broca's aphasia might say, "Book, read at table," instead of "I want to read the book on the table." Their speech is often slow and effortful. They may get frustrated trying to express themselves. Despite these challenges, individuals with Broca's aphasia are often aware of their difficulties. They may use gestures or facial expressions to compensate. Speech therapy can help improve their communication skills. Wernicke's aphasia primarily affects language comprehension. Individuals have trouble understanding spoken and written language. Their speech may be fluent, but often lacks meaning. Wernicke's area, located in the temporal lobe, is responsible for language comprehension. Someone with Wernicke's aphasia might respond with a string of unrelated words when asked a question. For example, they might say "blue car singing yesterday" when asked about their weekend. Their speech sounds grammatically correct, but makes little sense. Individuals with Wernicke's aphasia may not realize their errors. This can make it challenging for them to communicate effectively. Speech therapy focuses on improving language comprehension and functional communication. Section 4. Global aphasia, severe communication impairment. Global aphasia is the most severe form of aphasia. It affects both speech production and comprehension. Individuals with global aphasia have significant difficulty communicating. They may only produce a few words or sounds. This type of aphasia typically results from extensive damage to the language centers. This includes both Broca's and Wernicke's areas. Communication is severely limited, often to basic gestures or facial expressions. Individuals with global aphasia require intensive support. Alternative communication methods, such as picture boards or communication devices, are often used. The focus is on maximizing their ability to interact with their environment. Section 5. Transcortical motor. Aphasia, disrupted speech planning. Transcortical motor aphasia affects the connection between Broca's area and other brain regions involved in speech planning. Individuals have difficulty initiating and organizing their speech. Their comprehension is relatively preserved. For instance, someone with transcortical motor aphasia may struggle to start a conversation or answer open-ended questions. They might speak slowly and with reduced sentence complexity. However, they can repeat words and phrases easily. This type of aphasia highlights the complex network involved in speech production. Damage to specific pathways can disrupt the flow of information, leading to unique communication challenges. Section 6. Transcortical sensory aphasia, impaired speech. Comprehension. Transcortical sensory aphasia affects the connection between Wernicke's area and other brain regions involved in processing meaning. Individuals have difficulty comprehending the meaning of words and sentences. Their speech is fluent, but may lack coherence. Someone with transcortical sensory aphasia may repeat what others say without understanding the meaning, known as echolalia. They might also use words incorrectly, or substitute words with similar sounds. This type of aphasia emphasizes the importance of integrating language with meaning. Damage to these pathways disrupts this process, leading to impaired comprehension. Section 7. The importance of understanding aphasia. Understanding aphasia is crucial for supporting affected individuals. It's important to remember that aphasia is a language disorder, not a cognitive impairment. People with aphasia are still intelligent and capable. Patience and understanding are key when communicating. Using simple language, speaking slowly, and giving them time to process can help. Alternative communication methods, such as gestures or pictures, can also be beneficial. By raising awareness and providing support, We can help individuals with aphasia navigate the challenges of communication and live fulfilling lives.